because when we talk about mental health, we want to talk about maintenance. We want to talk about prevention. We don't want to wait until we hit burnout in order to get support. So here's some realistic self-care strategies that we should be doing. Setting and following healthy routines. I know is easier said than done. I know my parents out there are maybe not getting the most sleep, but keep moving, keeping active, trying to get as much sleep when you can, finding your support system. We talked about this in the quiz, but unplugging could be a huge form of self-care, especially a few hours before bedtime, because it really helps with getting good sleep. Setting those boundaries that we have been talking about, learning how to say no, and the fact that no is a full sentence. And sometimes in a professional way, if we communicate the right way, we can say no in the workplace and we can say no in other settings as well. So learning how to be the best advocate for yourself is part of self-care. Learning how to ask and accept help and support. This is something that culturally, especially within the Latinx community, we were not taught how to ask for help, right? We were taught to stay quiet, to stay in our lane, but asking and accepting help can be a huge part of our self-care. And now the last ones are gratitude and reflection. So this may seem, silly for some of us who are not taught how to do this, but using affirmations are huge. Doing guided meditations and reflections could be a huge part of our self-care strategy, and taking time to yourself. If you are a student, learning how to take breaks, intentional self-care breaks throughout your days, and also not just students, right? But professionals, we need it as well. If your job offers you an hour break, take it and not work. If they offer you 15 or 30-minute breaks throughout your day, take it and be intentional. Try not to work as much as possible so that you can take care of yourself throughout the day as well. And now the next slide, we're gonna go. So we talked about this in the beginning, right? We've been, the theme of our presentations have been when sana sana is not enough, right? And sana sana, as you guys know, is a saying that was taught to most Latina or Hispanic kids. And it's basically, it can minimize in a way getting the direct support that we might need. So when it's not enough, these are the triggers and the things that you should be paying attention to, which is going to lead you to whether or not you should probably get connected to additional support like a therapist or a counselor. So what you should look for is anything you notice of a change in your body and your thoughts. We know ourselves better than anyone else. Yes, our parents know us well. Yes, our siblings and our best friends know us. But really, we can only say when we feel a change in our body and our thoughts. If you feel like you can't talk to your family or your friends, that's something that definitely warrants additional support. If you can't get out of bed to go to class as a student, or if you're missing deadlines or your attendance is low, that's something that you want to pick up on and make sure you get connected to the resources that are on campus. If you're eating or not eating, overeating, or forgetting, that also may be a sign. These things are not all exclusive, right? It doesn't mean that just because you notice any of these one things that you do have a mental health challenge. That doesn't mean anything. It's just things that you should pick up on when you recognize major changes that are happening. Over engaging with fun or self-medicating, and obviously the most important, any suicidal or other thoughts of self-harm or harming others is definitely something that you want to make sure that you get connected to a therapist or a counselor to be able to support you. And now to wrap up, Gustavo will go through the resources that we have been sharing. We know it's incredibly difficult to get connected to a therapist, but we hope that these are able to support you.
Yeah, so some of you may be interested in Latina or Latinx, Hispanic specific therapists. So these are some good databases, right? So Therapy for Latinx, Latinx Therapy, Latinx Practice Collective. Through Psychology Today, you can also filter it like through insurance or your needs, language. or identity, or you can also call your insurance company directly, and you can also verify if they do take or if they can cover that therapist. But these are some ways that you can find ones that are directly related to your Latinx identity. These are some other national resources, right? So the JED Foundation, Mental Health America, Trevor Project specifically for LGBTQ youth, National Suicide Prevention Lifeline, the Veterans Crisis Line if you're a veteran. If you're in a disaster, right, or experience a disaster and that's causing you distress, you can always call in and ask for help or get connected to help. The Samson CDC may still have some good resources in the American Foundation for Suicide Prevention. So these are all kind of national resources. Some of them have just general resources or information if you're looking to explore. Mental Health America also has like a it's not a true test or evaluation, but more so of a check-in, like taking your temperature at home. So you can take a screening test and say, if it tells you that you may be experiencing depression, then that may be a sign that you want to talk to a therapist, right? Or that you actually go see a doctor. Similar to if you had a temperature, you may want to consider kind of going to a doctor. This is what I was talking about. So there's depression tests, anxiety tests, amongst others. They've actually expanded a lot in the last few years. And then these are some of the JED Foundation, the Mental Health Resource Center. If you want to take care of your own mental health, or you want to help a friend, there's just different information again, and just wanted to present some reliable resources here. But that's all the information we have. So we'll have a couple more minutes, or I can stay on for a couple more minutes. But thanks again for joining us. Here's our contact information if you want to stay connected or have more questions or want to schedule time with us. But thanks so much for making sure that you joined today.
I'm going to take time to just stop recording now. So if anyone wants to ask questions, they can. And that will not be recorded.